Hey there, Kim Ross here again. Today, we are shining a light on a topic that's surrounded by myth, ovarian cancer. Imagine this, myths are like shadows that sometimes hide the truth. Well, we are here to sweep those shadows away and reveal the truth. Here are 5 common ovarian cancer myths that we are going to set straight. Myth number 1. You won't notice symptoms until it's too late. Have you ever been told that you won't see any signs of ovarian cancers until it's too late? Like hidden treasures that nobody can find? Well, that's not quite true. Think of your body as a secret messenger that sends you a little signal when something isn't right. This signal might be a bit quiet, like a gentle tap on your shoulder, but they are important to pay attention to. Here's what you should watch out for. Feeling really full. Sometimes you might notice that your tummy feels super full even you haven't eaten a lot. It's like your tummy is trying to tell you something. Transferring. Your tummy might seem bigger or puffy like a balloon filling with air. That's another sign. Different cramps. You could have cramps that don't feel like your usual ones during your period. They might feel unusual and comes and go. These signs are like clues from your bodies that some things might change inside. It's a bit like noticing dark crowds gathering before a big storm. These little clues are there to help you, like your body's way of saying, hey, something's different. So, if you ever notice these signs, talk to a doctor about it. Myth number 2. Ovarian cysts mean cancer. Imagine thinking that if you have something called an ovarian cyst, it's like a straight road to cancer. But let's slow down and learn the truth. Most ovarian cysts are pretty common and harmless. Think of them like a cloud in the sky, coming and going. Now, when we talk about ovarian cancer, that is something else entirely. Hang out in the cells on the surface of your ovaries, and only a tiny bit of cyst ever turn into cancer. So, just having a cyst doesn't mean cancer is about to happen. Here's a bit more to make a crystal clear. The real deal about ovary cysts. Frequent visitors. Ovarian cysts are like your usual everyday guests who visit every now and then. Lots of people have them, and they often disappear on their own. Ovarian cancer is real. Now, ovarian cancer is like a super rare guest at a party that almost never show up. Only a very small numbers of cysts ever decide to turn into cancer. So don't worry too much if you heard the word cyst. It's more like a brief rain shower that usually go away by itself. But if you ever have questions or concerns about cysts, just have a chat with a doctor. They can help you understand things better. Myth number 3. No family history, no risk. Imagine this, thinking that if nobody in your family has had something called ovarian cancer, you are completely safe. Like assuming you won't get a sunburn because no one in your family had ever had one. But let's get things straight. While family history can matter, it's not the only pieces of the puzzle. In fact, only a tiny part of ovarian cancers are connected to a family's history. Ovarian cancer can sneak up on anyone, even your family has never had one before. Here's a bit more to help you understand why family history isn't the whole story. Genetic play a part. Yes, your gene, the thing that made you unique, can be important, but they are just one part of the story. Lots of factors at play. Ovarian cancer is like a big recipe with many ingredients. Family history is just one ingredient in the mix. It can happen to anyone. Ovarian cancers can happen to anyone, whether or not it's happened in your family before. It's a bit like a surprise guest at a party. So, don't assume you are safe just because of your family history. Ovarian cancer can affect anyone, and it's not all about genes. Myth number 4. Ovarian cancer is always incurable. Have you ever heard that if someone has ovarian cancer, it's like they are stuck in a never-ending problem? Well, let's change that thoughts. Finding ovarian cancer early is super important. When we catch it in its early stages, there's a very good chance of getting better, like a superhero moving and save the day. In fact, for an early stage ovarian cancer, about 92.4% of people survive and get back to feeling good. Now, even we can find ovarian cancer a bit later, there are still ways to help. It's a bit like when you are out of playing and a rainstorm suddenly appears. It might seem tricky at first, but you can find shelter and wait for the sun to come back out. Here's a bit more to understand. The power of early detection. Like a detective, doctors are a bit like detectives and they look for clues to find cancer. If we find it earlier, it's like solving a puzzle while it's still small and manageable. Even late stage can be treated. If we found ovarian cancer later, it can be tougher, but there are treatments available. Thinking of like battling a big storm, it might take more effort, but you can still come out okay. So, don't think that ovarian cancer is always a never-ending problem. With early detection and the right care, it can be like a passing storm and sunshine can follow. Myth number 5. Only older women are affected. Have you ever believed that ovarian cancer is something that only happens in older ladies? Well, let's straighten that out. While it's true that ovarian cancer is more common in women over 50, here's the surprising part. It can also affect younger women. In fact, 1 out of every 5 cases happens to women who are not old. It's a bit like finding out that rain doesn't pick who gets wet based on their age. Ovarian cancer can show up in anyone, no matter how young or old they are. But how does it happen to younger women too? Let's take a peek. Why younger women can get ovarian cancer? Not always about age. Ovarian cancer isn't just about how many birthdays you have celebrated. Sometimes it can happen because of other things, like change in your genes or family history. It's like some people get wet from rains, even if they are not the oldest one in the neighborhood. Hormones in play. Sometimes hormones, the chemicals in your body, can play a role. Think of them as a little messenger that can sometimes make things a bit complicated. Still a mystery. While we know some reasons why ovarian cancer happens, there's still a lot we are learning. It's a bit like trying to solve a puzzle. We have some pieces, but not whole picture yet. So don't think that age is the only thing that matters when it comes to ovarian cancer. It's a bit like rain. It doesn't care how old you are. In summary, ovarian cancer myth clarified. Fact number 1. Ovarian cancer can hide, but need to pay attention to small signs. Fact number 2. Most ovarian cysts are normal and not cancer. They are different things. Fact number 3. Family history matters, but ovarian cancer can affect anyone. Fact number 4. Finding ovarian cancer early helps a lot in treating it. Fact number 5. While it's more common in older women, younger women can get it too. Now, let's talk about what causes ovarian cancer and what symptoms to look out for. Causes of ovarian cancers. Ovarian cancers can happen due to genetic change, hormones imbalance, and other factors. Researchers are still uncovering all the reasons. Symptoms of ovarian cancer. Watch out for signs like persistent blocking, feeling full quickly, unusual abdominal or private pain, change in bathroom habits, and unexplained fatigue. These symptoms can be signal that it's time to talk to a healthcare professional. Stay informed and attentive to your bodies. Empower us to recognize the signs, reduce fears, and take action for healthier future. If you have concern or experience symptoms, consulting a healthcare professional is crucial. Early awareness is our shield against ovarian cancer. Thank you for joining Kim Law today. Before we wrap up, show some love by hitting that like button, subscribing to our channel, and sharing this enlightening insight with your friends and family. Let's break down this myth and arm ourselves with knowledge. Until next time, stay informed, stay alert, and keep spreading awareness.